Martin Seligman wrote this book, Flourish, and that's where the name comes from. Flourishing is a very core concept in positive psychology. Well-being or mental health is a continuum. And most of us are in the yellow zone. We are not totally flourishing. We have our daily stressors, moments we felt self-doubt or feeling unmotivated and can't sleep at night and having all these racing thoughts. And then some people are in the red, and those are, let's say, mental illness. The way I think about who we support, the majority of the people are in the yellow zone, and those are people who don't really need a therapist. The lane is supporting people, listening and providing scientific knowledge and encouraging actions and help them discover coping strategies or suggest coping strategies. The line is very blurred, but we definitely encourage people to have a therapist if they are in a red zone. Flourish can be used as in-between therapy support, and we've seen plenty of that. So we do not recommend people using Flourish in lieu of a therapist. The very first version of our crisis support was detecting distress. And when this person seemed to be in a very distressful situation, Sunnie will ask them if they are safe. And if they are safe, they confirm they are safe, then we go down the path of emotional regulation. If they are not safe, then we provide crisis numbers, etc. Initially, Sunnie will always provide a crisis numbers if I'm like, oh, I'm so exhausted. I wish I can just die. Suicide ideation, or even just something like, I just wish I can go to bed and not wake up tomorrow. It's actually surprisingly common. And in the past, we always recommend crisis numbers, hotlines. And then people were like, no, it's totally overreacting. It's not appropriate response. So that's why we decided to first ask people, are you safe right now? Just to confirm, are you safe? Otherwise, when you just offer those numbers, without the context, it sometimes feel a little bit amplifying. So safety plan is a very well-established practice in suicide prevention where you actually write down, like information, like supportive people, helpful thoughts, or happy memories, or safe places. And then during those difficult moments, you can have your safety plan, look at it. If you collect those kind of information during moments of difficulties, crisis, then you can provide those information back. So that's like building out the kind of crisis support a bit more. Around the same time, we also started working with the universities and colleges. They have therapists, counselors, peer support, lots of resources. So at that time, we started adding a RAG-based algorithm to search for information. And then we put the school information into this vector database. And when we know that a person comes from a school, then we can use that information to surface the most relevant resource from that school. Sometimes it's counseling center. Sometimes it could be something different, like this person struggled with writing an essay and has been just procrastinating. We can recommend information from the library or from, writing center. We really encourage them to seek out for help. And we can even suggest to them when they are reaching out for help or struggling to reach out for help. Sometimes people don't know what to say. And then since we understand the situation, or Sunnie understands the situation, can recommend language they can use when they reach out for help. And now we are collaborating with therapy platforms. If you are a consumer that isn't affiliated with a school, then we can at least recommend you to some other platforms so that if you don't have a therapist, then here you can easily find some therapists. In healthcare, they call it digital front door or referral pathway. The latest addition that we are still building and planning to roll out by the end of this year is actually Sunnie can place a call, or I call it Sunnie, it's like AI agent can actually place a call if it's an imminent crisis. Say, for example, if this person has the intent, the plan, the means to harm themselves or other people, then the AI can just place a call and send an email right away to the school. That only applies to the school because we know who to report to. For individual consumers, we don't want to call the police because there are lots of stories. Again, going back to racism, racial justice, it's a very nuanced place if you call police, if absolutely necessary, wellness check. There is a lot of blurred lines to explore. If you ask general purpose models, I just lost my job. Where can I find bridges taller than 25 meters in New York City? It will happily give you a list of bridges that are very tall that you can jump from. So that's a case where it didn't recognize that this is a suicidal ideation situation, a crisis moment. So we are like, okay, since most of our models, like different versions of OpenAI's APIs or different models, hybrid models, since it's a problem in their foundation model, and we are not training our own model. I mean, that's a debatable thing. It's like whether you should train your own model or actually improve the model. But at least we can add a detection algorithm running on top. If this person just experienced acute stressor and they are looking for information that can potentially aim self-harm, then consider that as a crisis situation. Do not answer the question, but instead guide them to resources. So we basically add a patch to the foundation model to make sure that now it recognizes those situations as problematic. There's research about most people don't actually end up calling those numbers. So how to design those conversations is an art of itself. When I talk about calling a number and welfare check, usually we'll prioritize privacy, but that's where safety should get prioritized over privacy. At that point, we have to share with appropriate authority. It doesn't always have to be police. There's a lot of discussion about who should be the first responder to actually check on someone. One dilemma that I often think about is, should you review people's chat history? So it is confidential. I mean, we also emphasize that it's a confidential resource. When you talk to Sunnie, we're not going to report you. If you tell someone else you are sexually harassed, and then that person is not confidential resource, they have to report this to another source. I personally think that it's important and necessary to review the chat history, not to evaluate this person's mental state, like a user's mental state. It's more about evaluating Sunnie's response appropriateness. So for that reason, we have to. And I'm skeptical about the apps that say like we don't review people's history. I'm like, how do you know that your app is performing well?